Good afternoon and welcome, everyone. I'm Laura Adams. I'm the chair of the National eHealth Collaborative Board of Directors. Thank you very much for joining our meeting today, whether in person or online. I'd like to start today by congratulating and introducing the newest members of our Board of Directors. We're excited to have 6 brand new board members joining us and delighted that our 3 incorporators have volunteered to join us again for NEHC's very important second year. Those new board members are Dr. John Tooker. Dr. Tooker is Executive Vice President and Chief Executive Officer of the American College of Physicians. John's on for a 1-year term. Jonathan Perlin is Chief Medical Officer and President of Clinical Services at Hospital Corporation of America, and John's on for another 1-year term. Dr. John Glasser, Vice President and Chief Information Officer of Partners Healthcare. Now, Dr. Glasser has not officially joined the board and will do so on April 1st when he finishes his tenure at ONC. And we look to welcome him again. The 3 that I just mentioned are all AHIC successor incorporators, and Dr. Tooker was our immediate past board chair and largely responsible for the very successful first year. Our new board members are Dr. Pamela Cipriano, Special Advisor to the Chief Nursing Officer of the University of Virginia Health System. Helen Darling, President, National Business Group on Health, for 1-year term. Nancy Davenport Ennis, Founder and Chief Executive Officer, National Patient Advocate Foundation, Consumer Representative with a 3-year term. Dr. Brent James, Chief Quality Officer and Executive Director, Institute for Healthcare Delivery Research, Intermountain Healthcare, on for a 1-year term. Paul Uhrig, General Counsel, Executive Vice President of Legal and Finance, and Chief Privacy Officer at SureScripts, on for a 3-year term. Dr. Seth Foldy, State Health Officer and Administrator, Division of Public Health, State of Wisconsin. Dr. Foldy is an ex officio non-voting representative of state governments. There's a couple of housekeeping items before we move into our stakeholder forum today. For those of you able to join us here in person, printed copies of the agenda and presentations or slides are available. Is it just outside? Is it, Mariann? Just outside? And for those of you online, the packet can be downloaded from the NEHC website at www.nationalehealth.org. That's www.nationalehealth.org. As always, we welcome your questions and comments via the webinar or email. Email them to info@nationalehealth.org. Again, the email address is info@nationalehealth.org. Or our staff is also monitoring Twitter, #NEHC. We ask that everyone participating online submit your questions and comments for today's stakeholder forum in writing, but we will also have a public comment period at the end of the session in which I will individually unmute phone lines if you'd like to share any comments with us. If you'd like to speak, please make sure you're logged into the webinar and use the webinar-generated attendees ID when you called in on the phone. With that, I think we're ready to get started with today's stakeholder forum and to hear from our partners from the Office of the National Coordinator for Health IT. Very excited to call this session of the National eHealth Collaborative Board of Directors meeting to order. I'd like to call now for any conflict of interest disclosures that may be appropriate. Thank you. We'd like to begin this forum. This forum is the NHIN 101, an introduction to the nationwide health information network. I think we're going to start our forum today with a very interesting presentation and discussion. One of the key initiatives of the Office of the National Coordinator for Health IT, or ONC, in 2010 is the evolution of the nationwide health information network. We're honored to have with us 2 key representatives of ONC, Dr. Doug Fridsma, Senior Advisor to the National Coordinator, who oversees all NHIN and interoperability activities, and Mariann Yeager of the ONC Office of Policy and Planning, who deserves a great deal of credit for the success of the NHIN initiatives thus far. Dr. Fridsma and Ms. Yeager will give us an overview of ONC's work to develop the nationwide health information network by taking us through the NHIN's past, present, and most importantly, its future. Joining them by phone from his office at the Pacific Business Group on Health in San Francisco will be Dr. David Lansky, Chair of the HIT Policy Committee's NHIN Workgroup, who will share with us several recent recommendations made by this workgroup to Dr. Blumenthal on NHIN requirements to address meaningful use-related data exchange. We're looking forward to a very interesting set of presentations that follow, and then a very lively, we hope, discussion and a session of Q&A. Dr. Fridsma, if you'd please introduce your colleagues, we'll get started.
Thank you so much. I just want to say, as way of introduction, that I'm delighted to be here. I think NEHC is a vital partner in advancing the goals that we have with the HITECH Act. Congratulations to you on such a great set of people that you've brought onto the board, both continuing and new members. And I really do look forward to the work ahead that we have with your group in ONC. To that end, we have a presentation. I will start off, and then I will hand things over to Mariann Yeager, and then finally to David Lansky on the phone. So I guess I'll control this. Okay. So by way of introduction, I am currently a senior advisor to the Office of the National Coordinator. I'm working as the acting director of the Office of Interoperability and Standards, and so that includes both the recent IFR that has been published in the Federal Register. It includes the standards and implementation specifications, reference implementations, the work in the NHIN and the certification criteria for electronic health records. I'm joined by Mariann Yeager. She is in the Office of Policy and Planning and really focuses in on the policy, governance, and regulatory issues involved with the Nationwide Health Information Network. And David Lansky, who joins us by phone, is the President and Chief Executive Officer of the Pacific Business Group on Healthcare. He is, more importantly, the chair of the HIT Policy Committee and the NHIN Working Group, and they have done tremendous amounts of work to provide us with recommendations and strategic directions within the NHIN. So the things that we'd like to talk about today is both to set the context for NHIN and sort of our future vision, what we see coming down the road. Talk a bit about the limited production exchange. This is the current set of stakeholders that are using the Nationwide Health Information Network to exchange information. And then we'll turn it over to David, who can give us an update on the work that's gone on with the work group and sort of the plans and recommendations that they've brought forward so far. So by way of context, all of the work that we're doing with regard to NHIN has been dramatically impacted by the passage of the HITECH Act. The American Recovery and Reinvestment Act era authorized incentives for the meaningful use of electronic medical records that would help to reduce the cost and improve quality while making sure that patients' privacies were protected. The national agenda was deemed to try to increase access to care, improve quality of care, decrease the cost, and promote meaningful use of EHRs. And it really is quite an interesting piece of legislation in the sense that it really made a distinction between simply installing an electronic health record and actually using it to affect patient care. And I think that was something that has really been focusing for the work that we've been doing. So to that end, a lot of the work that we've been doing within the Office of the National Coordinator has been trying to promote this national health IT agenda. One of the first things that we've been working on is establishing standards, technology services, and trust to support interoperability. That includes developing nationwide standards for information exchange, many of them reflected in the recent regulatory interim final rule that was published in the Federal Register last month. We're also working on programs to support research and development of new technologies through some grant programs coming out of the ONC to help support new technologies and new advances in areas that we don't have as much research or understanding. And finally, to provide guidance in the nationwide health IT standards and agreements, and this includes some of the trust relationships, the limited production, DRSA, and other things that are part of the NHIN exchange. The second thing is that we've been working very closely to stimulate the adoption of interoperable electronic health records. And this includes working very closely with CMS on their Notice of Proposed Rulemaking, the NPRM, that defined the financial incentives in the way in which providers could reach meaningful use. Paired with that is the regulations that make sure that the certified medical record systems, electronic medical record systems, have the capabilities to exchange information. And so paired together with both financial incentives and the tools that providers will need to be able to meet those meaningful use criteria, those two things together are intended to stimulate the adoption of interoperable electronic health records. And finally, we're promoting the meaningful use of electronic health records to improve quality and efficiency. And this includes assisting providers during selection and implementation. There are regional extension centers and other programs that are coming out of the office to help provide boots on the ground support to providers and provide educational support and implementation resources. There is recently announced grants that are gone to a variety of states to support both educational activities, the regional extension centers, and state health information exchange networks. And we are developing showcase communities and national models. There's a beacon community proposal that is currently under review to try to identify leaders in the communities that can help guide the rest of the nation and provide us early adoption models and ways in which we can work together for interoperability within health IT. So to that end, I think we're here primarily to talk a bit about what the Nationwide Health Information Network is. And if you think about it, we've gone back and forth about whether we should even use the word "the" in terms of describing the Nationwide Health Information Network. We decided that we use "the" to describe the internet, even though it's not really a thing but a collection of different wires and the like. Well, the NHIN is really a set of policies, standards, and services that enable the internet to be used for secure and meaningful exchange of health information to improve health and health care. And this is a definition that has really stood this test of time, even as we're thinking about novel ways of exchanging information in response to the HITECH Act. But it really is the frameworks, the policies, the standards for exchange, and the kinds of things you can do with that information, the services that provide a secure way of exchanging health information to help patients. So when we think about this, we've been really taking this notion of those three components as the definition of the NHIN to help us recognize really that there's a broad range of exchange needs. So that on the one hand, if you look at the slides on the left-hand side, there are some kinds of information exchange that really requires very simple kinds of services, policies, and standards to be able to enable that kind of exchange to occur. There are also much more complicated and much more robust ways of exchanging information. So for example, if I wanted to send as a provider a patient care summary from Mayo Clinic in Scottsdale to another hospital or a provider that I work with, I may not need a lot of, I may only need a few standards on how to format that, a few of the standards in the way in which that's packaged and transmitted in a secure and private way. But that's very different than if I were to, say, participate in a network in which I could put a query out there and say, I have an unconscious patient in the emergency room. I need to find out everything I know about this particular patient, and I want anybody out there who knows anything about this patient to send me information. There's very different sort of policy, standards, and services that are required for those. But we recognize that NHIN encompasses this entire range, and we want to make sure that as the information exchange occurs out there, that we don't have a one-size-fits-all, but in fact there's likely to be a heterogeneous way in which different kinds of information exchange will use different but compatible sets of standards. There's currently work underway to establish what those requirements are for kind of local applications, and we recognize that throughout this, that trust fabric, no matter what the level of exchange, trust fabric is essential. We need to be able to know that the information is coming from someone that we trust and going to someone who will be a good steward of that information.